The first speaker of today is Dr. Koji Nakagawa from Sugiyama Clinic, Shinjuku. He is a chief physician of Sugiyama Clinic, Shinjuku. He received a MD Ph.D. degree from Tokushima University in year 2000. And now not only is a chief physician in Sugiyama Clinic, he's also a fellow of Clinical Reproductive Immunology, American Society of Reproductive Immunology, ASRI. Also, he's a board member of Japan Society of Fertilization and Implantation. The title of his talk is Embryo Transfer Using EmbryoGlue for Patients with History of Heart Failure. Dr. Koji Nakagawa, please turn on your microphone and please, would you share your screen?
Thank you, Mr. Aguata, and good afternoon, ladies and gentlemen. My name is Koji Nakagawa from Sugiyama Clinic, Shinjuku, which is a private clinic for infertility treatment in Tokyo. And it is a great honor and pleasure for me to be here as an invited speaker at this Vitrolife Pacific seminar. The title of my talk is EmbryoGlue using embryo transfer using EmbryoGlue for patients with history of ART treatment. Today, I focus on hyaluron enriched transfer medium EmbryoGlue. I have no conflict of interest in this presentation. Today, my talk consists of 4 parts. First, I will review the relationship between the hyaluron and the embryo implantation. And second, I will explain the advantageous effect of hyaluron enriched culture medium for embryo development. And then I will show the clinical data of the embryo transfer using hyaluron enriched transfer medium. And finally, I will show the optimizing embryo transfer for the patient who have a history of ART failure. At the beginning, I will review the relationship between the hyaluron and the embryo implantation. This schema shows the relationship between the menstrual cycle and the window of implantation, WI. As you know, the WI is opened 6 to 7 days after ovulation. Hyaluron today is the main character. Hyaluron is a long-chain polymer up to 10 million Dalton comprised of beta-glucuronic acid and N-acetylglucosamine. This is a schema of hyaluron. Glucuronic acid and N-acetylglucosamine are connected alternately. Hydrophilic polymer of structure capable of absorbing water to form hydrated gel. And long-chain hyaluron makes up extracellular matrix with other proteoglycan in uterine endometrium, oviduct, ovary, and developing embryo. This schema shows the expression dynamics of hyaluron in uterine endometrium. Hyaluron fluctuates along the menstrual cycle, spikes twice per in a cycle, and peaks around the WOI. Hyaluron is synthesized by hyaluronic acid synthesis, HAS. It is expressed in plasma membrane. New hyaluron chain is synthesized from N-glucosamic acid and beta N-acetylglucosamine and beta-glucuronic acid. In mammalian species, there are 3 types of the hyaluronic acid synthesis, HAS1, 2, and 3. In uterine endometrium, HAS2 is upregulated in follicular phase. Then, in contrast, the HAS3 is upregulated in luteal phase. This photo shows the hyaluron and hyaluronic acid synthesis expression in the mouse embryo. HAS1 and HAS2 were expressed in mouse embryo, and HAS2 continue to keep high until molar stage. The hyaline is also expressed in the mouse breast cyst and implanted breast cyst. This table shows the hyaline and the HAS in uterine endometrium and embryo. In uterine endometrium and embryo, hyaline level peaks at around WY, and extracellular matrix around the embryo in cleavage stage and breast cyst. So HAS in uterine endometrium, HAS2 is upregulated in follicular phase and HAS3 is upregulated in luteal phase. In embryo, HAS is strong expression of HAS2 and 3 found until molar stage. Hyaline can be categorized by the hyaluronidase, a number of the enzymes of the hyaluronidase family. The hyaluronidase 2 expression just before and after breast cyst hatching. This graph indicated that the higher hyaluronidase 2 was found in good grade breast cyst and succeeded in the embryo transfer group. Hyaluronidase usually used in ART labs, and hyaluronidase 2 extracted from the bovine testicle. It is provided as a concentrated solution at 80 international units per milliliter. Hyaline the long chain hyaline is categorized by the hyaluronidase 2, and intermediate size of the hyaline can be binded to the CD44 hyaline receptor. Hyaline receptor CD44 is present, expressed both in mouse embryo and uterine both embryo and uterine endometrium. From this fact, it is plausible that the hyaline is involved in the initial phases of embryo attachment to the uterine endometrium. Extracellular matrix with long-chain hyaline promotes anti-inflammatory cells such as the regulatory T cell, conferring the environment with immunotolerance. In contrast, when the extracellular matrix is disturbed by injury or the infection, low molecular weight hyaline facilitate pro-inflammatory response, including suppression of dendritic cell and the TNF-alpha secretion by effector T cell. This is a brief summary about hyaline. Hyaline is a micromolecule synthesized on the plasma membrane in embryo, uterine endometrium, oviduct, and ovary. The expression of hyaline and hyaluronic acid synthesis were fluctuating along the menstrual cycle. It is lower at the ovulation around and rapidly rising toward WY. Long-chain hyaline in extracellular matrix promotes the activities of anti-inflammatory immune cells such as regulatory T cell. Next, I will explain the hyaline enriched advantageous effect of the hyaline enriched culture medium for embryo development. Supplementing culture media with hyaline brought a good reproductive outcome. This data was published from Professor Gardner in 1999. Adding hyaline group showed a significantly higher implantation and fetal developmental rate than those of the control. Hyaline can improve the survival rate of cryopreservation. Black bar indicates the re-expanded after thawing, and white bars indicated hatched blastocyst after thawing. Either using BSA or recombinant arming, using the Hiran group shows a significant higher survival rate without Hiran group. The Vitrolife G3 medium, which is Hiran supplemented sequential medium, brought a good reproductive outcome. Using the day 3 embryo transfer data, the blue bar was the G3 and the gray bar was the control. So using the G3, the embryo development rate and the clinical pregnancy rate, the G3 group are significantly higher than the control. The blastocyst embryo transfer group, the G3, using the G3, the blastocyst formation rate, good blastocyst rate, and the clinical pregnancy rate are significantly higher than those of the control. This table shows the viscosity of commercially available culture medium. Viscosity is expressed, measured viscosity in case of water as defined as 1. To enlarge the viscosity part, EmbryoGlue, which contains 0.5 milligram per milliliter of Hiran, shows some 3.59 of CP. And Vitrolife G3 series, which contains 0.125 milligram per milliliter of Hiran, shows between the 1.65 and 1.77 of CP. On the other hand, the SAGE-1 and UTM medium, which may contain Hiran, show the 1.21, 29, and 1.28 CP respectively. Considering the herpes buffers CP 1.15, these two medium thought to be not Hiran enriched, but Hiran enriched like medium. This table shows the safety profile of culture medium using the serological recombinant component. Look at the endotoxin and lot variation parts. Using the serological component, endotoxin is higher than the recombinant component. And using serological component, lot variations are high. And using recombinant component, there is no risk of viral contamination. So this is a brief summary about Hiran and the culture medium. Hiran supplementation makes the culture medium composition closer to the in vivo environment to oviduct fluid and endometrium in luteal phase. It enhances the variability of embryo in cultures, improves the survival rate of the cryopreservation, and improves the embryo transfer success rate. The next, I will show the clinical data of the embryo transfer using EmbryoGlue. There is a 5 RCT reports about the Hiran transfer medium. I will show these two papers, the result later. There are several RCT reports cited in Cochrane Review 2020. Among them, in these papers, the EmbryoGlue were used as a Hiran antigen transfer medium. Urman, who is a Turkish medical doctor, published the advantageous effect of the EmbryoGlue in 2008. This is a fresh embryo transfer on day 3 data. Blue bar was EmbryoGlue group and gray bar was the control. The patient who was 35 years of age group, the EmbryoGlue group shows a significantly higher implantation than the control. The patient who have a history of previous embryo transfer failures, the using EmbryoGlue group shows a significantly higher implantation than the control. This is the same. This is the same report from the month. On day 5 data, the blue bar was the EmbryoGlue and the gray bar was the control. The patient who are 35 years of age group, the EmbryoGlue group shows a significantly higher implantation than the control. The patient who have a history of embryo transfer failure, using EmbryoGlue group, the implantation rate is significantly higher than the control. This is our data published in 2012 using a fresh or frozen embryo transfer for RIF patients. In my paper, patients were younger than 40 years of age with a history of repeated implantation failure 4 times or more times of failure. Embryo transfer using EmbryoGlue showed a significantly improvement in success rate of fresh embryo transfer, natural cycle frozen embryo transfer, and hormone cycle frozen embryo transfer. This was presented by ASRM 2019 meeting. Hyaluron improves the embryo transfer success and reduce the miscarriage rate among the PCO patients. This is a meta-analysis of EmbryoGlue. Both fresh embryo transfer and cryopreserved embryo transfer using the EmbryoGlue, the pregnancy and implantation significantly higher and improved. Currently, the PGTA is becoming popular, and many breast cysts after biopsy, the TE, were used for the cryopreservation. This was a retrospective study at a single center in the United States. The former period using the Hepes-Baha without hyaluron. In a later period, using the EmbryoGlue for the cryopreserved breast cyst transfer after TE biopsy for PGTA. Using EmbryoGlue, clinical pregnancy and ongoing pregnancy rate were significantly higher than the control group. In our clinic, the PGTA is available for the RIF patients. Using the euploid embryo transfer, the clinical pregnancy rate was more than 60%, and it was not affected by the age. Look at this graph. The euploid breast cyst with poor graded morphology showed the not so high pregnancy rate. However, the euploid breast cyst with poor graded morphology, using EmbryoGlue significantly improves the pregnancy rate. This is a brief summary about hyaluron energy transfer medium for the clinical data. So hyaluron energy transfer medium improves the fresh embryo transfer outcomes, both day 3 and day 5 of those patients who are older than 5 years of age and those with previous embryo transfer failure. Frozen embryo transfer outcomes were also improved for our patients. And our recent data also showed improvements in the transfer of euploid blasts with poor morphological grades. And finally, I will show the optimizing embryo transfer for the patient who have a history of ART failure. This schema, the influencing factor of embryo transfer success. The pathological factor caused RIF are chronic endometriosis, pro-inflammatory response due to the infections, altered Th1-Th2 ratio, solomophilia, and microbiome imbalance. The suboptimal conditions such as advanced maternal age, poor graded or fewer cellular count of the blast cyst, and morphology and chromosomically abnormal blast cyst. To overcome or to reduce these negative effects, the optimizing culture medium or the optimizing transfer medium should be used. The uterine receptivity and the WI should be considered, and appropriate ovarian stimulation protocol should be selected. Moreover, actually, recommended to the younger patient to receive ART treatment as soon as possible, and to produce good grade and higher cellular count of the blast cyst and chromosomally normal blast cyst. So these were the road can bring a higher chance of the embryo transfer success. This is the conclusion of my presentation. The EmbryoGlue is prepared, should be prepared during the embryo culture and before the embryo transfer. The reason why the medium formulation closer to the in vivo environment around the WI, high concentration of hyaluron can help maintain immunotolerance of environment in uterine endometrium, especially effective for the patient with RIF history, as well as patient in the 40s. Embryo transfer success rates can be further optimized in the combination with PGTA, as well as endometrial receptive analysis, ERA. Thank you very much for listening to my presentation, and thank you for taking the time to join today. Thank you for attention.
Thank you very much, Dr. Nakagawa, for excellent presentation. Please hold on a second. Okay, great. Is my video on? Yes. Yes. Here is one question coming already. Dr. Nakagawa, thank you very much for your excellent presentation. And it is very interesting, your data showing that there is a significant improvement shown on euploid embryo transfer, especially euploid but poor morphology embryo. And that is in line with Michael Reed's presentation in 2022 this year, which also showing the improvement in euploid embryo transfer. Now, you are apparently the early adopter of hyaluron-enriched transfer medium, and showing significant result. And have you tried something, not just hyaluron, but any other medium to try in embryo transfer when in earlier time?
Thank you very much for the question. So we started to use EmbryoGlue in 2012. So before then, I tried to some medium with HCG was tried. So but unfortunately, it was not good result. So my expectation. So I disappointed that the result. So we would start to using the EmbryoGlue for the embryo transfer for the RF patients at that time.
Thank you very much. So the EmbryoGlue was, you tried not just a hyaluronate, but some other things, and then found out that hyaluronate was effective in embryo transfer. That's
Yeah,
great.
exactly.
There's another question. Thank you very much for your interesting presentation, Dr. Nakagawa. Does CD44 expression change in endometrium at day 5 or day 6? If WI is pre-receptin error test, is CD44 expression high in day 6 endometrium?
So to attach the embryo to the uterine endometrium, the WI is so more important than the expression of the CD44. But both WI and the CD44 expression during the WI are so wide ranges. So it is, but I think that I think that CD44 is not the same time we opened, but it is very close relationship between the CD44 and the WI.
I see. So it's not CD4. CD4 is not the only factor dominating the WI.
Yeah, exactly.
Thank you very much. One more question. How do you use EmbryoGlue? Put the embryo into it before embryo transfer, or keep embryo in the EmbryoGlue for a while?
So in our clinic, so the 30 minutes before to perform embryo transfer, we will in the EmbryoGlue medium.
Mm-hmm.
So only the 30 or the 60 and 1 hour was 30 minutes before the performed embryo transfer.
I see. So in just at least 30 minutes before transfer.
Yes.
Thank you very much. Okay, great. Thank you so much, Dr. Nakagawa, again for excellent presentation about optimizing embryo transfer using hyaluronate enriched medium.